Imagine you have just finished a heavy oily meal. Within minutes, your body knows exactly where to send bile to digest those fats. But have you ever wondered which tiny tubes carry the bile from the liver to your intestine? That's where the extrahepatic biliary apparatus comes in. A small but incredibly important drainage system of the body, and even one part gets blocked, it can lead to gallstone, obstructive jaundice, or severe abdominal pain. In the next 10 minutes, I will explain the extrahepatic biliary apparatus with the simple diagrams, easy flowcharts, and high yield clinical correlations. By the end of this video, you will understand the bile ducts, gallbladder, cystic duct, and common hepatic duct, common bile duct, and their clinical importance without memorizing complicated anatomy. So, if you are MBBS student preparing for university exams or NEET PG, you are in right place. Let's simplify anatomy. Made easy. Here is the extrahepatic biliary apparatus consists of these 5 parts: right and left hepatic ducts, right and left hepatic ducts, common bile hepatic duct, then the gallbladder, then the cystic duct, and this is the bile duct. These are the 5 parts. Functions of each one by one. First, gallbladder. Bile is formed in liver, stored in the gallbladder, and duodenum second part receives the gallbladder for further digestion. Common hepatic ducts run downwards from the 3 cm about 3 cm and joined on the right side at an acute angle by the cystic duct to form bile duct. This is about 3 cm common hepatic duct run 3 cm, and this cystic duct forms here acute angle and it continues to form the bile duct. Accessory hepatic ducts are present in 15% of people, which arise from the right lobe of the liver usually and terminate in the either of the following: either in gallbladder directly, or cystic duct, or common hepatic duct, bile duct may be. In 15% people, accessory hepatic ducts are present. Here's each part we will see in detail one by one. Gallbladder. It is the pear-shaped reservoir for bile situated on inferior surface of the right lobe of the liver in the fossa known as fossa for the gallbladder. Here it is the liver from the posterior side, back side, and here it has the fossa for the gallbladder, and here is the gallbladder. It extends from the right end of the porta hepatis to the inferior border of liver. Here is the porta hepatis, and it is extends from right end of the porta hepatis to the inferior border of the liver. Its dimensions 7 to 10 cm length, width is 3 cm at the widest part, and capacity is 30 to 50 ml. Here are the parts for the gallbladder, that are the here's fundus, it is the body, and it is the neck. Let's see one by one. Fundus is the part which projects beyond the inferior border of the liver. Beyond the inferior border of the liver, it is the fundus. It projects in angle between lateral border of the rectus abdominis and the ninth costal cartilage, entirely supported by the peritoneum. Here it is entirely supported by the peritoneum. Relations: anteriorly, anterior abdominal wall, and posteriorly, beginning of the transverse column. Afterwards, we will see in the diagram. Second one is the body. Lies in gallbladder fossa of the liver. It is the fossa and it is the body of the gallbladder. Upper end is continuous with the neck of the gallbladder at the right end of the porta hepatis, and the superior surface is devoid of the peritoneum because it is adherent to the liver. Here is adherent to liver, so there is no anterior border for this. So inferior surface is covered with the peritoneum, like the fundus of the gallbladder. Then the relations: inferior surface is related to beginning of the transverse column, and the duodenum, first and second part. Then the neck: narrow upper end of the gallbladder situated near the right end of the porta hepatis, and curves anterior-superiorly first, and then curves posterior-inferiorly to become continuous with the cystic duct. It is the, you can understand, anterior-superiorly first, anterior-superiorly, and then the posterior-inferiorly. It is the 3D. I can't imagine like these lines, but you can understand. Afterwards, anterior-superiorly first, and then curves posterior-inferiorly at the back side to become continuous with the cystic duct. Superiorly, neck is attached to liver by the alveolar tissue, and at the junction of the neck, the cystic duct constriction is present. It's related inferiorly. It's part of the first part of the duodenum. Some important points related to neck region of gallbladder, that the mucous membrane of the neck is folded spirally to prevent any obstruction in flow and outflow of the bile. These spirally folded spirally folds you will see in afterwards in diagrams. And one is their Hartmann's pouch. Posteromedial wall of the neck is dilated outwards to form pouch called Hartmann's pouch, and it's directed downwards and backwards, and gallstones can get lodged in this pouch. It will see in next diagrams, but here also you can see this, not clearly, but here is the Hartmann's pouch. In the next diagram you will see clearly, more clearly. And here is one, another is Callot's triangle. Callot's triangle, I will show you. This is the Callot's triangle. This is the segment of the liver, fifth segment of the liver. It is the gallbladder. It is the Hartmann's pouch. This is the Hartmann's pouch, and this is the Callot's triangle. Let's see detail about the Callot's triangle. Boundaries: inferior border of the liver, cystic duct, and common hepatic duct, and it contains cystic artery, cystic lymph nodes of the lung. See, this is the inferior border of the liver, and here are the cystic duct and the common hepatic duct are the boundaries, and contains cystic artery and cystic lymph nodes of the lung. Next we will see the functions. Concentration of the bile. Bile may be concentrated as much as 10 times reservoir for the bile and released into duodenum when required. Absorb small amount of loose bile salt cholesterol compound, and the bile salts have powerful solvent action on the cholesterol. Then if gallbladder is inflamed, concentration function is become abnormal, then bile salts alone are absorbed, leaving behind cholesterol, and cholesterol can precipitate and major disease or major form that leads to gallstone formation. Regulates pressure in biliary system by the appropriate dilation and contraction. Here is the relations gallbladder. Here is the first part of the duodenum. It is the second part of the duodenum is related to body, and here is the fundus part related to transverse colon. Here is the same diagram like porta hepatis. Right end of the porta hepatis starts gallbladders, and this is the fundus part. It is the Callot's triangle. It contains the cystic artery and cystic lymph node of lung. Borders are the inferior border of liver, cystic duct, and common hepatic duct. Then this is the spiral walls of the hiaster at the cystic duct. Next we will see the cystic duct. Length is 3 to 4 cm and begins at the neck of the gallbladder, then downwards and backwards to the left side. Ends by the joining common hepatic duct to form the bile duct. Mucous membrane of the cystic duct has 5 to 12 concentric folds which are spirally arranged and form spiral wall of hiaster. It is not a true wall. This is 10 to 12 spirally folded walls of hiaster. It is not a true walls. Let's next see the bile duct formed by the union of common hepatic duct and cystic duct near the porta hepatis. Length is 8 cm and diameter is 8 mm. Course: the bile duct first runs downwards and backwards in the free margin of lesser omentum. It is the supraduodenal part, and then it runs behind the duodenal part. Which part? First part of the duodenum. It is the retroduodenal part. Behind means retro, hence it's called as the retroduodenal part. Then lies behind the head of the pancreas. It's called as the infraduodenal part, and near the middle of left side of the second part of duodenum, it comes in contact with the pancreatic duct. Hence it also called as the intraduodenal part. Fourth part. Bile duct has 1, 2, 3, 4 parts. The relations of the bile duct by the part wise, we have seen the 4 parts. First part is supraduodenal part, anteriorly related to liver, posteriorly related to portal vein and epiploiforamen, and to the left side related to hepatic artery. Retroduodenal part, anteriorly duodenum, first part posteriorly inferior vena cava, and to the left side gastroduodenal artery. Infraduodenal part, which is the third part, anteriorly related to posterior surface of head of the pancreas and posteriorly related to inferior vena cava. Intraduodenal part, which is the fourth part, course of the bile duct through duodenal wall is oblique. Within the wall, bile duct and pancreatic duct unites to form Hepatopancreatic duct or the ampulla of Vater. Distal constricted end of the ampulla opens at summit of the major duodenal papilla 8 to 10 cm distal to the pylorus. Here is the duodenal wall, and here is the bile duct, and here is the pancreatic duct, and here is form the major duodenal papillas, and hepatopancreatic ampulla is formed here, and there are these four sphincters we will see here. Sphincters related to bile duct and pancreatic duct. First one is sphincter of Oddi or Cholelithiasis, present at the terminal part of the bile duct before its union between pancreatic duct. It is a ring of the smooth muscle. It keeps lower end of the bile duct closed and helps in accumulating bile in the gallbladder. And second one is the sphincter pancreaticus, present at terminal part of the pancreatic duct, not always present. In some people will be present, and sphincter ampulla, that is the sphincter of Oddi, surrounds the hepatopancreatic ampulla. See, here are the three sphincters. These two are the sphincters of Oddi or Cholelithiasis, these two, and here is the sphincters of Oddi, and here is the sphincter of the Oddi, duodenal wall, major duodenal papilla. This is the duodenal wall. Let's see about the arterial supply of the extrahepatic biliary apparatus. Cystic artery branches from posterior superior hepatico-duodenal artery, that is the branch of the gastroduodenal artery, and right hepatic artery. These three arteries and the supplies the gallbladder, hepatic duct, cystic duct, and upper part of the bile duct. Branches from the posterior superior pancreatico-duodenal artery supplies the lower part of the bile duct, and right hepatic artery supply to the middle part of the bile duct. Here is the celiac trunk. Then it forms common hepatic artery that give branch, that is gastroduodenal artery, then common hepatic artery forwards to the proper hepatic artery, then forms to right and left hepatic arteries, and left hepatic artery forms cystic artery, and that had two branches, superficial branch and deep branch. Both supplies to the gallbladder. Venous drainage. Superior surface of the gallbladder is drained by the veins that enters the liver through fossa for gallbladder and joint tributaries of the hepatic vein. Rest of the gallbladder is drained by the half cystic veins, which drains into right branch of the portal vein. Lower part of the bile duct drains into portal vein. Here is the lymphatic drainage in bile duct, cystic duct, and hepatic ducts. Ostic node, which is present in angle between cystic duct and common hepatic duct, and the bile duct at the lower part, lower hepatic nodes, and upper pancreatosplenic nodes are there for the lymphatic drainage. Here is the nerve supply, that is cystic plexus of nerves. Parasympathetic nerves that motor to musculature and gallbladder and the bile ducts, and sympathetic nerves from the T7 to T9, vasomotor and motor to sphincters. Pain from the gallbladder may travel along vagus sympathetically and along with phrenic nerves, referred to different sites. By the phrenic nerves, it can be referred to the different sites, that is to stomach, to inferior angle of scapula, to the right shoulder, and to the right shoulder, referred to these three sides. To stomach through vagus nerve, to inferior angle of scapula through sympathetic nerves, and to right shoulder through phrenic nerves and supraclavicular nerves. Along with three types of nerves, that are vagus, and then sympathetic nerves and the phrenic nerves. Then the finally clinical anatomy. Biliary obstruction. First, complete or partial blockage of the passage of the bile into the duodenum, may be intrahepatic or the extrahepatic. Causes. It caused by the cancer of the head of the pancreas, compresses the bile duct, and second one is the gallstones, which slip into the bile duct and block it. Then the clinical features for the light colored feces, jaundice, bile pigment into blood, and dark colored urine, and pruritus means the itching. Light color stool plus dark wine and pruritus implies the obstructive jaundice. Above feature plus episodes of the pain likely to be obstructive jaundice due to gallstones. Above features plus lost weight likely to be due to the carcinoma of the head of the pancreas. You can differentiate two situations by these features plus episodes of pain and loss of the weight. Second one is cholecystitis, inflammation of the gallbladder. Patient complains of pain over right hypochondrium, radiating epigastrium, or the inferior angle of the right scapula or the right shoulder. And when we place our finger below the costal margin at the tip of the ninth costal cartilage, point feels a sharp pain on inspiration and catch in his breath, known as the Murphy's sign. It is so important Viva question. What is the Murphy's sign? Then third one is the cholelithiasis, formation of stones in the gallbladder, common in humans because of the low fatty acid in bile. More common in female because of the fat in female when fatty female and 40 years age, but also seen in the males. Murphy's sign helps to in diagnosis, and stones cause time to time spasmodic pain called biliary colic. Cholecystectomy, it is the operation for removal of the gallbladder. Courvoisier's law, dilatation of the gallbladder occurs only in extrinsic obstruction of bile duct like carcinoma of the head of the pancreas, or in intrinsic obstruction by the stones does not cause any dilatation. Referred pain, it is pain of stretch of gallbladder or this common bile duct is referred to the epigastrium, right shoulder and inferior angle of the right scapula. Here is the endoscopic retrograde cholangiography. It helps in assessment of the bile duct. Here is the extrahepatic biliary apparatus is over. If you like it, share, like and subscribe. Comment for next topic. Thank you.